Hi and welcome to the last section of this module, which is the motivation section. In radiography, patient safety and ethical practice is our top priority. In this video, we will discuss effective ways to protect patients from unnecessary radiation exposure. Firstly, patient protection in radiography. Radiation at high doses can be harmful, which is why governing bodies have set limits to reduce risks. For minors, the dose limit is 1 millisievert per year, the same as for the general public. There are several ways of reducing patient exposure. However, in this video, we will only discuss 6 of them. First, minimizing repeat radiograph can directly reduce patient exposure. It is crucial to improve communication between technologist and patient. Give clear breathing instructions to avoid motion issues, explain the procedure to reduce anxiety, and let patient know about any movement or noises they might experience during the exam. Give a clear explanation of the effects of injections to the patient and avoid carelessness in positioning or selecting incorrect technique factors. A true knowledge of anatomy is the key for accurate positioning. Combine all of the knowledge in practice to achieve better results. Second way of reducing patient exposure is correct filtration. Filtration in X-ray is able to reduce patient exposure by absorbing low-energy X-ray that do not aid in image formation. It hardens the beam, improving penetration and shifting to a higher energy. Filtration is either inherent or added, with regulation setting a minimum of 2.5 mm aluminium for most diagnostic radiology at 70 kV or higher. Technologists must ensure the right filtration is used, adjusting it based on patient size to minimize skin dose. Third is collimation. Close collimation significantly reduces tissue dose as you move away from the X-ray field. At 3 cm from the field edge, the dose is only 10%, while at 12 cm, it's about 1%. Always limit the X-ray field to the area of interest, ensuring collimation borders are visible on all 4 sides if possible, without cutting off essential anatomy. Fourth is gonadal shielding. Male gonad shields usually position distal to the symphysis pubis, covering the testes and scrotum as depicted in the image. Meanwhile, the female gonad shield is placed proximal to the symphysis pubis and extend each way from the pelvic midline to cover the ovaries, uterine tubes, and uterus. Fifth is protection for pregnant patients. Always screen women of childbearing age for pregnancy before an X-ray. Display reminders for patients to notify technologists if they might be pregnant. If a pregnancy is confirmed, consult the radiologist before proceeding. For exams above the diaphragm or below the hips with low scattered dose, continue as usual. If the fetus is exposed to less than 10 mg, use low dose, consider lid shielding and limit views. For those above 10 mg, discuss alternative imaging options such as ultrasound or MRI. Inform the patient of risks and benefits, document decisions, and remember the 10-day rule is now obsolete as cancelling essential procedure may pose greater risk. Lastly, the selection of projection and exposure factors appropriate for the examination. Understanding the factors that affect patient dose is the key. Increasing kV during AEC can lower the dose, and adjusting technique factors manually is also helpful. The goal is to balance image quality with minimal patient dose. Remember, dose to the thyroid and female breast varies significantly between AP and PA projections in the head, neck, and upper thorax. Proper shielding during certain exams like female hip exam can reduce ovarian dose, while exolateral hip projections deliver a higher dose to the testes than lateral projections. Now, let's move on to the ALARA principle. Remember, the goal is to keep the patient dose as low as reasonably achievable while maintaining necessary image quality. Therefore, we should optimize imaging techniques based on the patient's condition and diagnostic needs. Use shielding, collimation, and proper exposure setting to minimize unnecessary radiation. It is essential to protect both patients and healthcare workers from excessive exposure. Third, radiation effects. As mentioned earlier, radiation at high doses can be harmful to our health. These are some of the early effects of radiation exposure and approximate minimum dose necessary to produce them. Next, ethical practice in digital imaging. There are 3 practices recommended to maintain dose at a reasonable and consistent dose level. Use protocol-specific kV and MAS values for every procedure. Increasing kV slightly and lowering MAS can maintain image quality while reducing patient dose. Always monitor the dose by checking that image meet the established exposure indicator. If the exposure indicator falls outside the acceptable range, review factors such as kV and MAS as digital image processing may be affected by deviations from manufacturer standard. Finally, we reach the last topic for this module, which is the effect of radiographic examination repetition. First, focus on patient well-being by reducing discomfort and anxiety, while optimizing resources to ease financial strain on healthcare institutions. Efficient time management means shorter visit and less waiting, improving workflow and patient care. Consistent image quality and accurate positioning aid in diagnosis and treatment planning. Finally, prioritize professional growth by continually improving skills, combination, and technical proficiency.